Hello, good morning, good afternoon, and good evening to everybody connected with us today. I'm Pragati, and I'll be talking about my experience of working with WHO Country Office for India in supporting the Government of India for the Midwifery Initiative. You must have all heard about the Midwifery Initiative of India, and today I'll be specifically talking about Framework for Action to Strengthen Quality Midwifery Education. You all must be familiar with this piece of document that was released in 2019. This document is a partnership. This document was released after the series of consultation in partnership with major organizations like UNFPA, UNICEF, International Confederation of Midwives, and World Health Organization. This document particularly talks about what and how to strengthen quality midwifery education for universal health coverage 2020. So it is a report that combines the global evidence with findings from a series of global multi-stakeholder consultations addressing 5 key questions. The 5 key questions are listed down here, but I'll be talking mostly about the 3 most relevant that are highlighted here to India. The first one is, what are the 3 strategic priorities? What will the impact be at the country level? How will this be achieved? So the 3 strategic priorities that were defined after the global consensus was every woman and newborn to be cared for by a midwife standards, and we talk about international standards in India, and I'm sure in the rest of the world as well. We are talking about the competences prescribed by International Confederation of Midwives. The second is to strengthen midwifery leadership. The 3 is to improve coordination between all stakeholders to align evidence-informed investments. These 3 strategic priorities also aligns with the priorities of Government of India. And after this 3 strategic priorities we identified globally, a 7-step action plan was introduced to strengthen quality midwifery education. This 7-step action plan talks about the how in implementing a quality midwifery education. So it talks about what goes in the circle and how to start and end in implementing quality midwifery education. So just before I move on to explaining what the 7-step action plan is and how India initiative fits in that 7-step action plan, I wanted to give a brief overview of what India's midwifery initiative is, and before the midwifery initiative, how India was implementing midwifery services. How, as in through what kind of workforce. So the existing workforce in India, we have 4 different varieties of workforce who implement midwifery services in India. The first one being auxiliary nurse midwives, called as ANMs. They work in the field at community health level and primary healthcare level and provide midwifery services. We have general nurse midwives. They work mostly at the secondary and tertiary level facilities in providing midwifery services. And we also have BSc nurse midwife, who is a graduate nurse midwife and works in a similar setting as a general nurse midwives in secondary and tertiary care facilities. And we have MSc nurses who also work in the secondary and tertiary care facilities, but they also have an added component where they are also educators. So the MSc nursing specialties are in varieties. The most relevant to this program would be the MSc nursing in obstetrical nursing and community health nursing, and remotely related to pediatric nursing. The 4th program in India that produces workforce for midwifery services is nurse practitioner in midwifery, which is a 12-month curricula purely for midwifery education. So the new initiative, the Midwifery Initiative in India, introduced a new cadre of professional midwives who will be termed as nurse practitioner in midwifery. But this one differs from the previous nurse practitioner in midwifery, as in this one has an 18-month curriculum instead of a 12-month curriculum. So the criteria for getting into this program, the nurse practitioner in midwifery program, for a person to be trained as an NPM, so should be an RN/RM. In India, an RN/RM status is given to either a general nurse midwife, BSc nurse midwife, and MSc nurse midwife. And she should also have 3 to 5 years of hands-on experience, as in clinical experience in a maternity ward setting. So this curricula, as I have already mentioned, runs for 18 months. The second component of the new initiative is to educating midwifery educators. So in India, we call them nurse practitioner and midwifery educators. So these are the educators who will be training the NPMs in the future. So to get enrolled in the NPM educators program, you need to have a basic graduate RN/RM. So you have to either be a BSc nurse and above, with an MSc degree. There is a preference from MSc nursing because we have an education component to it. So we do understand that the MSc nurses are more well versed with educating, and they need to have at least 5 to 6 years of hands-on experience with an added experience in teaching. So this midwifery initiative in India to train these two cadres of midwives, the professional midwives and the educators, have established a series of midwifery training institutes. At the national level, we have total number of 6 institutes that will train the NPM educators, and as we move down below in the system at the state level, we'll have state midwifery training institutes who would be training nurse practitioner and midwives through the midwifery educators trained in this 6 national midwifery training institutes. So now moving on to talking about the 7-step action plan, which has emerged out of the global consensus. So the 7-step action plan is centered around women and newborns. The first step is strengthening leadership and policy. The second step is about gathering data and evidence. The third step is building public engagement and advocacy, and a very important step, especially in countries we are launching midwifery, who are launching midwifery as a fresh initiative. Prepare educational institutions, practice settings, and clinical mentors in preparation of actually implementing and training the midwives. Strengthening faculty standards and curricula, educate students, monitor, evaluate, review, and adjust. So these 7 steps fall within the major 3 components of act, monitor, and review. So now in the next slide, I'll be talking about how India Initiative aligns itself in this within these 7 steps. And for the India Initiative, it is not that one thing happened before the other, as in the same sequence as the 7 steps, but we did many things simultaneously. So whatever might have happened in the first step would have happened later and would be planned later as well. And maybe whatever we did in the 4th step of, let's say, for example, preparing educational institutions, practice setting was done before, we did many of the things in the 1st step or 2nd step. So I'll be talking about details, what India did and how. So for the first step of strengthening leadership and policy, a National Midwifery Task Force was established, and the consultation in the National Midwifery Task Force informed the guidelines and midwifery services that was launched in India in December 2018. So we are yet to do a leadership training for midwives that was planned in early 2020, but due to COVID restrictions, we could not follow that up, and we will be doing it hopefully in the beginning of next year. So the second step, gathering data and evidence. WHO commissioned the study to Dundee University to do a desk review of barriers and facilitators to midwifery education in India. And based on the review, the syllabus of the previous NPM course was extended. There's a midwifery research underway, and we have already completed data collection, and hopefully by next year we'll have few publications out in the open. So this research basically is a baseline assessment of midwifery educators and providers' competencies that are prescribed by WHO and ICM respectively. And we are assessing ANMs, GNMs, and BSc nurses in this research. So the objectives basically are to assess midwifery competencies of both midwifery educators and clinical trainers, following which there will be evidence, there'll be a roadmap that will be prepared to say how we can, that shows the long-term pathway to strengthening the midwifery services and education in the country. Third step of building public engagement and advocacy. This was considered to be an important step by Government of India, as midwifery, professional midwifery would be very new to India. So to have that kind of traction and demand for professional midwifery services, once we implement the services, it was thought to be very important to have an advocacy strategy in place. So there was an ask from the Ministry of Health to WHO to develop an advocacy strategy for the state level. And we have done that already. An advocacy toolkit is ready, and it is yet to be disseminated, and the dissemination is being planned. The fourth step of preparing educational, institutional, and practice setting and clinical mentors. All partners we approach to support Government of India in assessing different institutions, whether they are ready to implement midwifery education and training of midwifery educators and midwifery practitioners. So institution assessment was done for more than 14 institutes, and out of them, 6 were identified as national midwifery training institutes. There is also a guideline for midwifery-led care units underway, and the midwifery-led care units are also being planned to be situated at the tertiary level facilities in India, where we have high birth load. And the MLT guideline basically would talk about new facility standards and architectural redesign and what to be done to make the existing facility more appropriate to function as a midwifery-led care facility. The 5th step of strengthening faculty curricula and standards, we have a midwifery curricula for NPMs for 18 months, and as already discussed, we have an NPM curricula for educators, which is for 6 months residential and 12-month mentorship. We also have a WHO midwifery education toolkit being designed at the global level that will be contextualized to India, and that toolkit will basically fit into the learning resource package that is being developed by Government of India for the syllabus of the NPM educators. So, on the request of Government of India, WHO also formed an international expert group on midwifery with 15 global experts, with 14 to 15 global experts who would give suggestions and inputs on the guidelines, the draft guidelines and other documents which India would be preparing as we move on in implementing midwifery services in the country. The 6 steps of actually educating the students, that are the students here would be midwifery educators and midwifery practitioners. Government of India in 2019 started the first batch of midwifery educators training in Fernandes Foundation, Telangana, and international educators trained to international standards were recruited to carry on the training. So we had 5 international educators coming from UK and train the national educators to take the program forward in India. And I think it's pertinent to mention here, since India needs to sustain this program, and we need to build our own capacity. These international educators were clubbed together with one national midwifery educator who would be trained and mentored by the international educator to basically take their place when the program moves forwards in the coming years. The final step of monitoring, evaluating, reviewing, and adjusting whatever we have learned in the 6 steps, we are in the process of developing a monitoring evaluation framework, which relates to all the 7 steps, and hopefully it will be finalized by the end of this year or early next year. So this was about India, and I hope you have a brief about what India did in implementing midwifery education in the past 2 to 3 years, and how we intend to move forward in the coming years. And I'm sure you do have many questions, and I look forward to answering them if I can, and if not, I'll get back to you, after looking for answers. And I'm happy to very fruitful discussion ahead. Thank you so much for patiently listening.